your patient is a 62-year-old woman with a history of carcinoma of the sigmoid colon. Okay, that was removed 5 days ago. That particular carcinomatous growth was removed 5 days ago. The surgery was complicated by the escape of bowel contents into the peritoneal cavity. There was a leak into the peritoneal cavity. She now have fever and pain in the perineum and in the left buttock. On physical examination, her temperature is 39. My necrosis with a foul smelling discharge that is being coming out. Okay. The gram stain of the exudate reveals gram negative rods. So without giving any picture of it, they can ask you which organism associates with this particular one, and the options of yours are these one. Which of the following is most likely organism to cause this infection? Helicobacter pylori, Bacteroides fragilis, Salmonella typhi, Vibrio parahemolyticus. So answer to this question is no doubt Bacteroides fragilis, because this is the obligate anaerobe which is predominantly found in the gut, and in these gut surgeries only this is the one which can leak out, okay, and cause the infection. So this is obligate anaerobe, first thing, and it produces a mild potent LPS which can leads to endotoxic shock, which can leads to what? Endotoxic shock. Remember this thing also. Fine. Other than that, regarding Bacteroides fragilis, what other things you need to remember? The another things is that is the anaerobe, and all the anaerobic infections, what you have to catch from the question is they have a foul smell. Okay, foul smell coming out or foul smell pus is a characteristic feature of anaerobic infections. You can find some colors also in that pus. Okay, colored pus can also be produced by this particular fellow, and you know that they are being cultured up in the RCM, that is Robertson cooked meat media or broth. So that is important regarding the anaerobe which you need to remember. Okay, besides this they can show you a picture also like that, and they can ask up that this particular type of gram stain picture is there, which particular infection happens up in the above scenario. So answer is Bacteroides fragilis. And interestingly to know that this Bacteroides fragilis, which is there in this particular question responsible for the infection and all, can go to the brain also, and there also it can cause what? Brain abscess. It can go to the brain and it can cause what? Brain abscess there, and this brain abscess can be from the gut, it can go to the brain and does this. Fine. So Bacteroides fragilis can be associated with brain abscess also.